Welcome. My name is Allison Kempe. I'm a pediatrician and a health services researcher, and I'm the director of COPRH. We are honored and excited for COPRH to present our first national Pragmatic Research in Health Conference, Planning for Real-World Impact, Methods, Models, and Measures for Planning Pragmatic Research. While we would have dearly loved to have you on site, we feel confident that we can provide you with a very meaningful conference experience virtually. Before we get into what is a very full 2 days, I wanted to take just a minute to tell you about COPRH, the program that is hosting this meeting. COPRH was founded in 2014. It is co-supported by the School of Medicine, Anschutz Medical Campus, and Children's Hospital of Colorado. It is a research program focused on the entire life spectrum, and it's fully integrated across the School of Medicine and with strong partnerships with the School of Public Health. It's organized into programs and cores with designated leaders. To put COPRH in context within the Anschutz Medical Campus, COPRH supports all of the School of Medicine's T3, T4 science. That is, including effectiveness in real-world settings and population-based science. We do this in concert with the Colorado Clinical Translational Sciences Institute. Just to remind you of the need for this type of pragmatic science, as most of you know, it takes 17 years on average for 14% of research to translate into practice, and most research is never translated into practice. So we really need pragmatic science. COPRH was established with a number of strategic objectives: to promote innovative research to guide clinical practice, to achieve greater national visibility for T3, T4 science, to improve faculty development in outcomes and delivery science, to increase competitiveness for funding for T3, T4 scientists, and enhance the capacity for recruitment of these type of scientists. This slide shows the programs and methodologic cores housed at COPRH, all of whom are available to faculty at the Anschutz Medical Campus for consultation. You'll be hearing from some of the leaders of these programs and cores in the next couple of days, especially the dissemination and implementation, and community engagement and outreach programs, and the qualitative and mixed methods and biostats and analysis cores. COPRH is both an actual and virtual home for investigators from multiple disciplines. Some have primary offices with us, about 52 investigators right now, and there is also a much larger affiliated group with off-site offices. About 73 investigators routed 173 proposals over the last 2 years at COPRH. Just to give you some idea of the size and scope of the program, over the past 2 years, we've done almost 500 consultations with faculty in 28 departments and divisions per year. We've been part of 63 recruitment efforts and have mentored over 150 faculty in grant submissions. We currently support 59 faculty in their career development awards. COPRH's faculty has published almost 700 research manuscripts, and we've received funding from 55 grants totaling about $34 million. We have 2 fellowship training programs, one focused on primary care and the other on surgeons and subspecialists, but both training postdocs in health services research, and we have an MHLBI K-12 focused on dissemination implementation science. We do a lot of education, and I wanted to mention some of these because they are available online for your use. Every year we have 3 to 4 seminars, and this is just an example from last year. They have invited lecturers as well as our own faculty, and most of these are archived online. For example, last year there was one on behavioral science and healthcare, patient-centered decisions, and health equity. We also do a variety of workshops. Every year we do qualitative methods once or twice, designing for dissemination and modern study designs for pragmatic research were also workshops that occurred last year. And we are planning to take some of these workshops nationally as well. So COPRH Con is the first time we've done a national series, and this will be a 3-year series, as Bethany will explain more about. Finally, I just want to give a shout out to our new National D&I Graduate Certificate Program. This provides rigorous training in D&I science for health services and public health researchers. It leverages some of our outstanding D&I faculty as well as other national D&I leaders as guest lecturers. And our first class began in June and August of 2020. And with that, I'm going to turn it over to Bethany Kwan, who is the PI on the COPRH Con grant and is our conference guru. Thank you so much for being here with us.